So Parsaclisib is a PI3K inhibitor that was designed and studied in multiple blood cancers and was the only PI3K inhibitor of its class that was studied in myelofibrosis. The first prospective study was the phase 2 study that was published in Blood Advances that showed the addition of Parsaclisib to select patients with myelofibrosis who are on optimized Ruxolitinib dose and continue to have a disease burden as measured by enlarged spleens and high symptoms, that the addition of Parsaclisib in these patients resulted in further clinical benefit, more spleen reduction and more symptom improvement and more clinical benefit. So we were very glad with the results from the phase 2 study. However, the combination of Parsaclisib was taken to phase 3 studies, and unfortunately those studies did not meet their planned endpoints, and at this point this drug is not under development for myelofibrosis.